but they're simple things. Like when people are discharged from hospital and man are a psychiatric unit, why do they not give them an appointment card? Why wait on a letter? A letter that doesn't arrive, in our case, a letter never arrived. You know, why not give somebody a wee card to turn around and say, you will be seen at this time, on this date, on this day. And because that's a lifeline. It's a lifeline to the patient, it's a lifeline to the carers, knowing that they're not going to be lost in the system, knowing they've got a target, knowing that they're somewhere going to be there.
A couple of months after the event, the panel of international experts produced their findings and recommendations. One of those recommendations was the card before you leave, and they made this recommendation, you know, for the Minister for Health. The card before you leave was seen as a simple, low-cost, reasonable thing that could be implemented very quickly. The next steps that the group took to make their rights a reality was that they found out that the Health Committee were doing a report into the prevention of suicide and self-harm. So they made a submission to the Health Committee on the card before you leave recommendation. They also lobbied MLAs and provided oral evidence at the committee as well. They were delighted actually when they found out that the Health Committee made the card before you leave one of their recommendations. It was one of 25 recommendations. In March and April, really, the group were just writing to various agencies who had responsibility for some of the issues that they were working on. So, for example, they wrote to the Department of Health on the new complaint system that was coming into place. In June 2008, the group met with the Minister, Michael McGimpsey, and he seemed to be very impressed with this recommendation for the card before you leave, as it seemed to be a simple, low-cost initiative that could improve mental health services. In August 2008, the group heard officially from the Minister that the card before you leave would be regionally implemented by 2009. So the group were just pleased to get that in writing, that it was actually going to happen. The next step for the group in September 2008 was to meet with Gerard Collins, who had been appointed liaison person to work between the group and the Minister. Gerard went on to set up a number of meetings with relevant officials in the Department of Health. One of the most important for the group was the meeting with Colin McMinn, who was involved in the setting up an implementation board to implement card before you leave. In November 2008, the group eventually met with Colin McMinn, and they specifically asked, were service users involved in the implementation board for Card Before You Leave? And I think at that point it was hoped that they would be involved, but there was no confirmation of it. The group believed that, have always believed that the campaign for A Card Before You Leave was a first step towards making the standard of Follow Up Within a Week a reality. So they reminded the Minister in December 2008 that the Card Before You Leave was only a first step, and they also requested that he should make the standard of Follow Up Within a Week a priority for action for the forthcoming year. At the end of January in 2009, the group had confirmation from the Minister that he had made the Follow Up Within a Week a priority for action. The wording maybe wasn't as the group had hoped, but they were still pleased that there had been progress made on the issue. The next thing the group did was contact the Minister again to see whether they could be involved in monitoring the priority for action. Initially, the Minister got back and said that they couldn't be involved in this process due to confidentiality issues. The group then sought advice from a member of their campaign support group, and when they got back to the Minister then said that they could work with the Belfast Trust on the monitoring process. When it came to April 2009, the group were disappointed that the Card Before You Leave system had still not been implemented. In fact, there had only been one meeting of the Card Before You Leave implementation board, and the meeting at which they were due to be represented had been postponed. It's fair to say that the group have found the Card Before You Leave campaign a very long and tiring process. In fact, it was a member of the group who first mentioned Card Before You Leave in 2005. It's now 2009, and we've just heard actually that it may be another 2 years before it is fully implemented. If there's something positive to come from this campaign, it would be that other groups will not be passed from pillar to post when they try to get better services and try to make their right to health a reality.